The Government Employees Medical Scheme, or GEMS, says it is ready to support government's efforts to prioritise frontline workers to receive the COVID-19 vaccine. This medical aid scheme represents over 754,000 principal members, which forms a large part of frontline workers in the government sector. GEMS says it has put measures in place to ensure that there is enough funding to cover the COVID-19 vaccine. This, of course, follows the announcement by President Cyril Ramaphosa that frontline workers will be prioritised when the vaccine becomes available in South Africa. Dr. Stanley Moloabi is the principal officer at GEMS, and he's with us to talk about this. Dr. Moloabi, thank you. Thanks so much for joining us.
Good morning, Leanne, and good morning to the viewers. And we also do appreciate the opportunity to come onto Morning Live.
Yeah, thank you for being with us. So GEMS said it is supporting government's efforts to roll out the vaccine to frontline workers. Do you have more details as to how you're going to support it, and when do we expect this to start happening?
Firstly, that support comes out of the fact that as the Government Employees Medical Scheme, we cover mainly the government employees. And out of the 754 principal members, 754,000 principal members that you have mentioned we cover, a lot of them are frontline workers. Actually, just under 200,000 of those are in the healthcare sector. And as a result, they are frontline workers. So the support comes from the fact that we will be, as a medical scheme, funding the vaccine of those who will receive it by means of the cover that they have from GEMS. So that is basically the support in terms of us covering government employees' medical scheme. And then in terms of the second part of your question as to when that will happen, we await the delivery of the vaccines. As you know, that the procurement of vaccine is at the moment being done by government. So immediately the vaccines arrive, and in line with the rollout plan, we know that in the first phase, the frontline workers, particularly the healthcare workers, will be the ones who will first receive the vaccine.
Okay, so obviously, I mean, you're reliant on government for a timeline of that. I mean, we have said that it could be as early as the end of this month or in February. Is that the information that you're getting?
Well, basically the information that is in the public domain, either via what the president has been saying or the Minister of Health has been saying, it is basically the information that we are basing our timelines on.
All right. So do you have a detailed list of who amongst your 255,000 principal members are frontline workers and who would be getting this first? I mean, obviously there is a plan to roll this out.
Well, I mean, on our membership database, we know who are working in the healthcare sector. We also know who works in the other departments. So the basis really of how that rollout will happen in terms of the list will be based on that information that is at our disposal.
Experts have been quoted in the news basically saying that government's rollout plans are logistically and financially flawed, which is very worrying, especially for, all of us, but healthcare workers who are putting their life on the line. What is your view on this? Are you confident about this? Are you worried about anything at this point in time that you'd like to draw to our attention?
Well, I think people have got different views on what the capability of delivery is within government. What we know is that there's a lot of planning that is going on in terms of how the rollout will happen. It is a huge undertaking, and one wouldn't expect that a huge undertaking like this should be flawless. However, I'm sure everything will be done because this is a matter of absolute importance to the nation. I think everything is being done to ensure that the rollout is done as efficiently as it possibly can be done.
Yeah.
So our view is that basically everything is being done to make a success out of this huge undertaking.
Yeah, I mean, we are knowing and hearing about the reports of medical professionals that are infected, that are just overwhelmed in hospitals and everywhere when it comes to COVID infections, and that are losing their lives as well. Perhaps you can tell us what it is like. I mean, when we talk about your members, we talk about the stories you're hearing about. What is it looking like on the ground?
Well, from the information that we also have, on our members, we certainly are aware that some of the health workers have been infected, and we follow the statistics based on the claims information that we have. And GEMS, because of the size of the scheme and the fact that it covers a wide range of people all over the country, tends to mirror what is happening in the entire population. So what I can tell you is that the rate of infection is similar to the statistics that are released at the population level, and the positivity rate is similar, and the death rate, and we know it's around 2.5%. The death rate is also around the same. So essentially, what I'm saying to you, what is happening in the entire population is mirrored is also on what is happening in the GEMS environment.
Just the cost. What is there an indication of the cost of the vaccine at this point?
There is information that the government has made available. I think within the discussions that are underway, what's the possible range of acquiring the various vaccines that will be acquired. Remember, it's not only one vaccine that the government is looking at. So there is a range, but possibly these are acquisition prices. What we are waiting for is what the ultimate price will be, at the point of delivery, because I think there's still a need that it should be determined what the logistics will cost, and what also will be the cost of the healthcare professionals who will be administering the vaccine. So at the moment, the ultimate cost at the point of vaccination is still not known. We are still waiting for that to be determined.
Yeah, which is a bit worrisome, because I suppose when you say that this is something that you're going to obviously prioritize funding for the vaccine, when you don't even know how much one vaccine is going to cost. How do you actually fund for this? I mean, how do you look and say, well, obviously we're going to put this aside, we're going to do that? How does this affect your planning when we don't even have a ballpoint figure as to how much it's going to cost?
No, we have done some work, and this is really benchmarking based on the information that we could use. So in our budgeting for this, for vaccine, and the budgeting was already done last year around September, when we determined our benefits for 2021. We did use benchmarking. Remember, the vaccine for COVID is not the only vaccine that is available. We have had vaccines prior for other illnesses. So based on those indicative prices that, the other vaccines that would be similar are acquired, we then based our budgeting on those. So benchmarking is basically an indicator of how much this vaccine may ultimately cost. But already there are indicative prices that the government is working with based on the stage of procurement that the government is at.
The COVID-19 vaccine has been pronounced as a prescribed minimum benefit. This is an entitlement by the regulator. What does this mean for your ordinary medical aid member?
What it simply means, Liane, is that the medical aids, all medical aids that are registered in terms of the Medical Schemes Act, are obliged to pay the cost of the vaccine for those members that will have received it at cost. And at cost is interpreted as that the member is not supposed to pay any co-pays after they've received the vaccine. And in simple terms, that's what it means. And that applies across all medical schemes.
I think I may have asked you this already, but just perhaps a bit more clarity. How will your frontline members actually access the vaccine once it becomes available?
They will access it at the vaccination points that will have been established as part of the rollout. And that, I think, is being planned as we speak. And there are lots of discussions, and we're involved in some of them, where planning is being done to establish vaccination points across the country.
Will it be mandatory? Will it be mandatory for all workers to get this vaccine, whether they want it or not?
Now, I think this has actually, I think it is the minister who have indicated that it will be on the voluntary basis. So while it is advisable that anybody who is exposed, particularly the frontline workers and everybody else thereafter, it is advisable for us to reach the herd immunity that has been spoken about by the experts, that everybody who has an opportunity to receive the vaccine, they should do so.
All right, I'm going to leave that conversation there. I want to move on to another conversation and a new development when it comes to what's been going on into the racial profiling of medical practitioners. So what we heard last night is that you have launched an urgent legal action to block the release of Advocate Themba Nukaitobi's scathing interim report on the alleged racial profiling of black, coloured and Indian medical practitioners by medical schemes. Something that we as a programme were, I suppose, one of the first to actually come forward, speak to some of these medical practitioners and their experience of what was going on. Why have you launched this now? What's happening?
So, Leanne, let me first start by saying we need to respect the fact that this matter is still before the court. So I will give you answers. However, we cannot go into the merits of the case as we are awaiting judgment from the sitting of yesterday. And the judge has indicated that they hand down their judgment tomorrow at 9:30. The question that you asked is, why did we take this action? And I think I need to clarify something. GEMS has, from the beginning, and even on your program, my predecessor, the previous principal officer, and that was in around April 2019, did indicate and commit that GEMS, and we are still committed to that we supported the Section 59 investigation. And that is still the case. Our prayer to the court yesterday was simple. It was basically to say we are requesting, and we believe it's in line with the laws of natural justice, that before the report is made public, we be given the opportunity of right of reply, and after which a final those submissions would be considered by the investigating panel, and then it would be made public. So what I have noticed in the media yesterday, the narrative was that we are blocking the release of the report. That is not the intention. The intention is just that we were praying to the court that we be given the opportunity to reply to the findings. And this is, we understand, being advised by legal, that it is normal procedure in an inquisitorial investigation that anybody against whom the adverse findings would be given a right of reply, after which a report would be finalized, and at that stage it can be released to whatever, to the public.
So you're not
in this case, we accept that it is a public process.
Okay, so you're not arguing that this should be released to the public, because this is in the interest of the public in a very big way, but you're saying that you need time to study this interim report before it is made public. Is that basically the basis of your argument?
And absolutely, and we are informed that the interpretation of the terms of reference by our legal advisors was such that there was an expectation that before it is released, the affected parties would be given the report, and then after which they would respond. And with those responses, the investigating panel would then consider those, and then only then the report would be made final. And I believe that is the normal procedure that is usually followed in inquisitorial investigations.
Yeah. So Nukaitobi basically saying that this is not an urgent matter and it should be struck from the roll, and that it should go ahead because obviously this is something that could cause immense reputational damage to GEMS medical scheme. What is your response to this? Do you I know it's before the courts and I do respect that, but you know, in the public interest. People should see this. We know this. But, you know, a delay, this has already been going on for a very long time. Do you think it's fair to institute another delay in this?
No, we don't want it to be delayed. We were just asking that a fair process be undertaken. And then once, in the terms of reference, I think there is a reference to about 30 days within which we would have been required to reply. And then within that 30 days, I would imagine that the panel would have made the final consideration of the answers that we would have submitted. And at that stage, the report would be made final. And having been made final, as I said, and we have committed, by the way, during our participation, that whatever the outcomes are that are fair and factual, we will obey and we will make good what we may not have done what we may not have done, in an acceptable manner, because this is what this investigation was all about.
All right.
So there is no intention at all on the side of GEMS to delay that this report be released.
All right, we'll leave it there. Thanks so much for talking to us. Dr. Stanley Moloabi from the Government Employees Medical Scheme, or GEMS, talking to us about, firstly, the role in the COVID-19 vaccine rollout. They're members of frontline workers, many of them, that are going to be receiving it when it does become available. And also the latest development when it comes to going ahead and saying that they want the delay in terms of that interim report on the racial profiling of medical practitioners in the country. So we leave it there. Let's quickly look